Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. Couple quick announcements. First of all, so happy we will start shipping my book, our book, Conversations with Pam. Tomorrow, actually, we'll be sending books out, maybe later today, but tomorrow for sure. You can buy autographed copies from us at Wellness Forum, or you can buy on Amazon or in bookstores or download to Kindle and Nook and all the different ways that people digest books these days. Super excited, anxious to have you tell us what we think about it. Looking forward to the discussion. And when you call us, you can also order fruit and nut crunch bars and smoothie mix and all kinds of good stuff too. The Happy Healthy Bootcamp started last week, and it's not too late to join. We're recording all of these sessions, and we will put them in your documents tab if you're a member after the bootcamp is over. But just think about it, for $195 if you're a member, you get 6 yoga classes, 6 strength training workouts, 6 cooking classes, and 6 lectures, health lectures. That's a pretty good deal, I think. I'm pretty sure. And you can have all that stuff in your documents tab for life. And if you're not a member, we can do something about that. We can cure that problem, and then you can get a cheaper price as well. And then the last thing that I'll mention is we had some technical difficulties with Winner's Circle. So we're starting October 7th. So there's still time to join. All right, so let's get into today's news. I've got 2 things to share with you, both of which I think are important. Last week, I was interviewed by a woman who is a breast cancer surgeon, and I'll post the interview as soon as she sends it to me. But I enjoyed our conversation very much. It's so fun to talk to intelligent people who are all about informed medical decision making. In this case, you don't meet many in the oncology field who recognize that DCIS isn't breast cancer and that we overscreen in healthcare and all that sort of thing. So it was a great interview, and I think you'll like listening to the whole thing. It went on for quite a long time because we had so much to talk about. But she asked me a couple of great questions at the end, and I wanted to spend time on one of them here. She asked me to summarize what it takes to lead a long and healthy, independent life, sort of like a list of what you'd put in an operations manual for humans. And I replied that I thought there were several requirements, and I think all of them are non-negotiables, in my opinion. So I'll just go through the list and add a little commentary on each. The first one is get lean. We have normalized being overweight or obese. In fact, there are so many obese people, now 40% of the population, that the person who carries an extra 35 to 50 pounds doesn't look so bad by comparison. But this comparative evaluation that people often use on themselves doesn't negate the risks associated with carrying the extra weight, which include an increased risk of cancer. In fact, I'm going to talk about this in my video next week about the increased risk of cancer in firm terms, concrete terms, and I think it'll shock you and might motivate you as well, or scare the heck out of you, which that works sometimes too. Anyway, but the place to start with this whole thing, I think, is to stop deluding yourself into thinking that you're not that fat, or that 35 pounds is not that much, or that you'll do it later when you have more time. You're never going to have more time. There will never be a better time than now. And every day you get a little bit older, which means that the extra weight that you're carrying is a little more dangerous. So now is good. And closely related to this issue, and we talked about this in the interview, is how do you know if you're overweight or how overweight you are? And my response to that was that you don't need scales or experts to figure this out. I'll tell you a real simple method. Take off your clothes, stand in front of a mirror, and you will have a really good idea about whether you're muscular or not. All right. And then do something about it now. And in Winner's Circle, by the way, we call this getting honest with self. Like solving any issue that you're dealing with starts with just a little bit of honesty, like where am I and where is it that I'm trying to go? Well, part of getting lean is getting serious about diet, and there is a right diet for humans, and Wellness Forum's pyramid reflects that. So stop fooling around and make the necessary changes. I mean, I talk to people all the time who get real serious about it when they have cancer, but they're having cocktails 2 or 3 times a week. They keep junk food in the house, and you're tempted to eat it, get rid of it. By the way, if you live with somebody who insists on having the junk food, buy a locked filing cabinet, put it in that person's room or someplace in the house, You don't have the key, and tell them to put it there. You might even have to get a small fridge and do the same thing. In Winner's Circle, we call this setting boundaries, and you have a right to do this. And in fact, you may need to do this to protect your health. So if you live in a land of junk food and you can change it on your own, great. If not, you may have to change it in cooperation with other people. Like, I don't want you to not eat potato chips, but I can't have them around, so lock them in a filing cabinet for me. I would be one of those people, by the way. If the stuff is here, I eat it. Second or the third thing is exercise and make sure it's enough to make a difference. We have an epidemic of what I refer to as exercise light. I'm sitting in my home office right now making this video, and I'm watching people walk by on the street. They're strolling along, talking to each other, stopping to talk to neighbors, or they're looking at their phone. That's a great way to get an aerobic workout, right? So you just can't do this. To make sure you're getting the most out of aerobic exercise, use what I call the talk test. If you can carry on a conversation, but you'd rather not, you're in your target zone. And if you can carry on a conversation like I'm talking to you right now, and like what I'm watching outside my window right now, then you're not working hard enough to burn off fat and build aerobic capacity. So this means you may need to go out and walk or run either alone or with people who are also interested in improving their health and willing to focus on exercise without the chit chat as well. You also need some strength training and yoga, and stop listening to people who tell you that exercise is bad for you and you can hurt yourself with strength training, or just being active and weeding your flower beds is okay. It's not. And don't tell yourself you don't have the time, because you do. By the way, we do a little time management work in Winner's Circle as well. I'll share something I've learned from people who have cancer. Most of them tell me that they thought they didn't have time to do this stuff too, but as soon as they get a diagnosis, they find the time, because their survival really counts on it. So don't wait to become a cancer patient to get serious about your health. It would be a colossal error. And then a few other things: sleep well and sleep enough, social engagement. We're all human. Humans are social creatures. Learn something new, read books, take classes, stretch yourself mentally, get happy, and find some purpose in life, and do all of these things. Another concept we teach in Winner's Circle is everything's connected to everything. And last but not least, start listening to the chatter in your head and what you're telling yourself. Whatever you're telling yourself, it's true. I always gain the weight back. Well, true that. If you keep saying it, I have to change my ways now. Actually, no, you don't. You don't have to do anything. Stop telling yourself that. It's so hard. Well, if you keep telling yourself that, it will be. My problem is, and if you keep insisting and repeating that you have problems, it just perpetuates them. So how you talk to yourself and the chatter in your mind is super important. Become real mindful of it. That's probably been one of the things I've paid attention to more in the last year than I ever have before. And I'm shocked at some of the chatter in my head. Was shocked, and some of it needed to be rewritten. So anyway, I hope that's helpful. That would be the outline of my operations manual for humans, which we discussed during my interview. And then the other thing I wanted to share with you today is a couple of excerpts from an essay published on the Brownstone Institute website, written by a doctor who was fired during the COVID debacle and opened his own practice. His name is Brooke Miller. He'd been a practicing physician since the 1980s, and says in his article that doctors were independent and accountable to their patients at that time, whereas now it's everything but the patient. And as he described his relationship with patients back then, it reminded me of the family doctor that my family had when I was a kid, who took care of my mom, my dad, my sister and I, my aunt, uncle, cousins, and our maternal grandparents, who all lived nearby. Well, today, doctors aren't in charge of patient care. Institutions and managers and accountants and government agencies like Medicare are making all of the decisions. And I think Dr. Miller made some super good points. One of them is the way that it's changed doctors. He writes, quote, "I've observed a definite decline in the attitude many doctors take toward their patients. There's a troubling loss of confidence in clinical decision making and a diminished ability to think critically about disease and illness. Too many physicians have abdicated responsibility for patient outcomes, hiding behind protocols and guidelines rather than taking ownership of their clinical decisions. Perhaps most concerning is the apparent lack of empathy many now show toward a patient's fundamental right to make informed decisions about their own healthcare." And by the way, I think it's because of the environment. I think doctors are inherently good people who go to medical school. Most of them are, but they're in a terrible environment. And it's the good apple in a bad barrel. If you put a good apple in a bad barrel, the bad barrel doesn't, it makes the good apple bad. The good apple doesn't turn the other apples good. So what's happened is doctors are asking permission to veer from standardized guidelines. I spoke a few weeks ago about this standardization where we're treating people as if they're widgets on an assembly line, and that's not really what healthcare is supposed to be all about. Perhaps his most important point, I'm just going to read this one of these couple sentences to you because I couldn't say it any better paraphrasing it. He writes, quote, "The corporatization of medicine has reduced many physicians from independent professionals to healthcare workers, employees who implement corporate policies. Electronic health records have transformed us from healers into data entry clerks. Prior authorization requirements have made us supplicants begging insurance companies for permission to treat our patients. Quality metrics have reduced the art and science of medicine to checkbox exercises that ignore protocol compliant, ignore the complexity of human health and disease. And there's more focus on protocol compliance than there is on patient outcomes. And so he writes, the path back to authentic medical practice requires courage, sacrifice, and commitment to our original oath. It means putting patients before profits, clinical judgment before corporate policies, and medical ethics before financial incentives. But the point is, it can only be done in a private practice setting. And it brings me to this as I reach the conclusion here. I think the way I'm supposed to spend the last couple of decades that I work, getting more and more health professionals out of organized medicine and into independent practice. To do this, really, we've got to get health professionals to want to leave, but part of what they need in order to leave is they need to have patients ready to patronize them. Doctors come out of medical school with a lot of debt. We have to be understanding of that. They have large salaries and families to support, and so we have to be able to give them some security. And the way that we do this is we gather hundreds of thousands of informed people who will patronize these types of health professionals, and then we can at some time flip the switch to a payment scheme that makes sense and pays for what people really want. So here's what Wellness Forum is going to do. I always try to come up with how can we do something to accelerate this process for the good of everybody. For the next couple of months, you purchase a membership from Wellness Forum, and we will give you a basic membership that you can give to someone else, as long as the person has never been a customer or member of Wellness Forum before. If you already renewed this year, you can do this too. Just provide the info so we can call the person to set it up. And again, the same requirement. Person cannot have been a client or a member before. Purchase a program like Winner's Circle will let you either have an equal amount of money to spend on other programs you want, or you can gift that program to another person. And that may be as long as they haven't done anything with us in the past. This will help us grow our reach, making it easier and easier for more and more people to leave institutional medicine and practice on their own. And so I guess what I'm looking at is if we want to make healthcare great again, and I sure do, and I know you do too, then we're going to have to do something different. So this is my proposal for something different. I think it will help everybody involved, and it will accelerate the process of growth so that at some point in time in the not so distant future, we have a healthcare system that works the way that you and I want it to work. All right. Please give me feedback on the book as you're reading it. We're anxious to hear what you have to say, and we'll probably schedule some study groups and things like that in just a little bit. We hear that you love those fruit and nut crunch bars, and of course, everybody loves the smoothie. And just so you know, a lot of you ask about gut health. I did a search. The medical literature is full of studies on the impact of green tea on the gut microbiome. So those of you who are doing the smoothie every day, drinking it for breakfast like I do, you're getting a whole lot of great nutrients, high fiber. I think the whole combination has like 14 grams of fiber, and you're giving your gut a little bit of love too. So don't forget that. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news. Thank you so much for watching.